A patient underwent a right transtibial amputation has been prescribed a prosthetic training regimen. Transtibial amputation means below the knee amputation. During gait analysis, the examiner noticed a presence of excessive flexion of the knee of patient's right extremity during heel strike after the prosthesis is done. This can be attributed to a softer heel cushion, socket too far anterior, excessive plantar flexion, show heel bearing lower. The answer is socket too far anterior. Both knees, if you don't understand the question or answer, watch again the videos, you can understand it. Correct answer is both socket too far anterior. Both knees should flex in a controlled manner during their respective early and late stance phases. Both knees should flex in a controlled manner during their respective early and late stance phases. Excessive flexion of knee on the amputated side indicates that the socket is aligned too far anterior in relation to the foot or is excessively flexed. This deviation may cause the patient to fall. Hence, the socket should make a reasonable contact with the leg. Other causes given in the questions are consistent with insufficient knee flexion.